Hi, welcome to Guideline Updates with MedStudy. I'm Dr. Eric Sherman, and linked below are the new recommendations for 2022 from the American Diabetes Association for the management of type 1 and type 2 diabetes in children and young adults. The updates for 2022 focus on diagnosing patients with diabetes, COVID vaccination, new diabetes technology, management recommendations, and finally, simplifying the annual screening recommendations. First, in diagnosing diabetes, if pediatricians use oral glucose tolerance testing to screen for diabetes, carbohydrate intake of at least 150 grams per day should occur for 3 days prior to testing. Children and young adults who do not have typical characteristics of type 1 or type 2 diabetes and have a family history of diabetes in successive generations should have genetic testing for maturity onset diabetes of the young. Next, in COVID vaccination, the COVID-19 vaccine is recommended for children with diabetes. Both the Pfizer and Moderna vaccines have grade 1 evidence ratings, meaning there are randomized controlled trials or overwhelming evidence from observational studies that demonstrate efficacy. In diabetes technology, time in range with a continuous glucose monitor is now considered a useful proxy of hemoglobin A1C and microvascular complications. As pediatricians, you will likely see even more patients with type 1 and type 2 diabetes using real-time continuous glucose monitoring, as long as they can use the device safely. In management recommendations, we are now recognizing that parents and pediatricians may be putting too much pressure on children to self-manage diabetes. The pediatric diabetes team should work with children and their parents or caregivers to ensure there is not a premature transfer of responsibilities for self-management. In addition, there are now specific recommendations that ACE inhibitors, angiotensin receptor blockers, and statin drugs should be avoided in females of childbearing age who are not using reliable contraception. Finally, in annual screening, as per the previous guidelines, children with type 1 diabetes should be screened for hypertension, autoimmune thyroid disease, celiac disease, dyslipidemia, nephropathy, retinopathy, and peripheral neuropathy, generally soon after diagnosis and then at specific ages or intervals. For 2022, the only change is that retinal photography can be used instead of a dilated fundoscopic exam when screening for retinopathy. There are no changes to the screening recommendations for patients with type 2 diabetes, but a brief reminder may be helpful. Like type 1 diabetes, children with type 2 diabetes should be screened for hypertension, dyslipidemia, nephropathy, retinopathy, and peripheral neuropathy. You don't need to screen for autoimmune thyroid disease or celiac disease in children with type 2 diabetes, but you do need to screen for non-alcoholic fatty liver disease and obstructive sleep apnea. Those are the 2022 updates from the American Diabetes Association. Thanks for watching.